In this episode, I welcome back women's health physiotherapist Winnie Wu to discuss the importance of women's health, this time focusing on menopause and perimenopause to share both the symptoms and lifestyle changes associated with these stages. Winnie shares the relationship between pelvic floor health in postpartum and the implications that can have later on in the menopausal years, the need for early prevention and treatment strategies, although it's never too late to start, and exercise recommendations tailored for women in their 40s and 50s. The discussion also highlights the importance of a holistic approach to women's health involving collaboration with various healthcare professionals and community engagement. This is an informative and insightful conversation that I'm sure you'll get a lot from. Enjoy. Hello, so today I'm welcoming back a guest that has been on in a previous episode. Her name is Winnie. Hi Winnie, can you tell us all about you?
Hi, Katura. Thanks for inviting me to the podcast again. So my name is Winnie. I'm an integrative women's health physiotherapist. I'm owner of Papaya Clinic and Movement Laboratory, which is like two clinics in the inner west of Sydney. And Papaya Clinic is a clinic that we do holistic integrative women's health for people across all life stages.
Beautiful. Okay, so just for those that haven't listened to our previous episode, we did talk a lot about preconception health, planning for pregnancy, the sorts of things that we want to be doing to make our health optimal, pregnancy, and a little bit about birth and early postpartum. But today I wanted to talk to you about the importance of being conscious really of our body's functionality after we've had our babies, because I also think that a lot of mums today are having babies a little bit later, and some of them are not too far into postpartum when they start to maybe move a little bit more into that perimenopausal phase. So can we start by explaining what is menopause from your perspective?
So perimenopause normally either is by age. So people coming in normally between 35 to 50 complaining of some pelvic floor symptoms. And those symptoms will make us think that this person is in perimenopause. And in perimenopause, because if you think about women's hormones, so progesterone, estrogen, and testosterone, they are basically going like a roller coaster. And menopause is basically a decline of these hormones, but the decline is not a gradual, steady decline. It goes like a roller coaster, so sometimes high, sometimes low. So that period is where people do get a range of symptoms, and everybody is very different. And those symptoms will be what we look at in that perimenopausal stage.
Okay, all right. So let's maybe separate some of these symptoms. What sort of could be happening with her pelvic floor at that time?
Yeah, so the main symptoms that people talk about in the pelvic floor area is stress urinary incontinence, urge urinary incontinence. So for example, they are laughing, coughing, sneezing, and they are leaking at the same time. So that's stress urinary incontinence. Urge is when they feel an urge to go to the bathroom, but they cannot hold it. So as they're running to the bathroom, or maybe it's triggered by a turn key. So turning the key to get into the door, or stepping out of the car to get to the front door, or even seeing the toilet. These sort of different triggers means that they will leak at that time of the trigger happening. So that is urge urinary incontinence. So these are two big complaints that people do come in between this age group. And other things would be a sense of heaviness, which is what we look at as prolapse symptoms, which is a pelvic organ prolapse. So yeah, these two things are normally what we see in the perimenopausal and postmenopausal age group.
Yeah, okay. So would these be things that woman maybe has had previously in her postpartum period, or could they just come out of the blue at this stage of life that she hadn't been experiencing, say, a prolapse beforehand?
Yeah, so I think it's mentioned in the last podcast that we did, a lot of pelvic floor symptoms can be asymptomatic. So maybe clinically, when we do an internal vaginal exam, we can see that there are changes in the pelvic floor due to birth or due to hormones, whatever it is. but they might not be symptomatic. And the symptoms can come around the perimenopausal age because of the hormone changes that's happening. So, for example, for prolapse, I might be able to see clinically when someone is bearing down or coughing that there is a bit of laxity in the tissue. Yeah, so I can see the pelvic floor coming down and we can see the bulge in there. But they may not have any symptoms until, late 40s or 50s when estrogen is dropping and you have increased sensitivity in the pelvic floor. And also there's dehydration of the pelvic floor as well. So everything is like, a dried up grape. Yeah. Because of that, then they will then start to feel heaviness. So that will be the symptom that report to us. But it
Okay.
might be happening ever since childbirth.
Yeah, that's interesting. I'm sure, like myself, a lot of women would not really be aware of this, of the longer impact that some of these postpartum complications can have. Yeah.
Yeah, definitely. So which is the reason why we always talk about a 6 weeks postpartum check. Yeah,
Mm-hmm.
so people do have much better outcomes, I find, when they are quite in tune with the pelvic floor in the pregnancy stage. So if they see a women's health physio in the pregnancy stage and they have done an internal examination, they have practiced pelvic floor muscle training, they're connected to the pelvic floor and know how to contract and relax, then going to postpartum, the rehab journey is a lot smoother. And also because they have more awareness of the symptoms and where they're at, if there is any sort of, let's say, laxity that we see postpartum, we can be preventative straight away. Yeah, so that the symptoms do not occur.
Yeah, okay. Yeah, so good. Okay, what if that woman is hypermobile? She has difficulties with stability in her joints, her collagen, her muscle tone. What sort of things could be expected there, and what can be done about that?
I think that puts a woman in a higher risk of some of these pelvic floor symptoms because if you think about it, so the without going too much into the pathophysiology of stuff, but prolapse, for example, means that your pelvic floor muscle, which is like a sling, a bowl of muscle and connective tissue that is inside supporting your pelvic organs, because of, for example, childbirth, labor, vaginal birth, or increasing weight or straining during constipation, a multitude of these add together over time the collagen reduce and there's increased laxity in that connective tissue. Yeah. So aging is also part of that process as well. But because it is all to do with integrity of the connective tissue, if you start off hypermobile and you have less collagen to start with and more of that sort of laxity in all your body parts, including your pelvic floor, you're at a higher risk of having pelvic floor symptoms.
Mm, mm.
Yeah. And that is just to do with prolapse. So for example, stress urinary incontinence is another one. So some people can have very good pelvic floor muscle contraction. Yeah. So if you think about your pelvic floor, it goes from sort of pubic bone all the way to the coccyx. And when it contracts, it's really good at sort of closing the urethra. And that closing pressure, it's what can keep you continent. Now, if let's say someone have really good, contraction, but because of this laxity in the urethra and in the connective tissue, what happens is when I contract and close, instead of actually closing the urethra, I'm just pushing everything forward. Yeah.
Mm.
So because of that lack of integrity, it's almost like there's no backing. So the pelvic floor muscle is not as effective as someone who has more integrity in the tissue itself.
Yeah, so interesting. And you're the person that brought that to my awareness about my hypermobility and just how it can actually affect my pelvic health too, which I never would have really at the time saw the connection. So it's so
Yeah.
good to bring this awareness out there.
Yeah, and another thing is because my past life I work with a lot of dancers, a lot
Mm.
of ballet dancers, and some of them are quite hypermobile and just quite laxed. Anyway, so that is something that I see all the time. And another thing with hypermobility is when it's also a learned thing for the person. If let's say you're quite lax to start with, sometimes is I find the pelvic floor can be actually quite toned. So what we call increased tone, hypertonic. Yeah. Because that is your coping strategy to make sure, and over a lifetime of coping strategy, to make sure that everything stays closed or stay continent. Yeah. And so that can also result in other symptoms as well. For example, pelvic pain. Yeah, which is because of that increased muscle tone.
Yeah. So when you're talking about pelvic pain, what are you actually talking about? Which
So
particular
yeah,
areas of the
so
pelvis?
pelvic pain, I'm talking the most common would be like what we call dyspareunia, which is having pain during intercourse, yeah, during
Hmm.
penetrative sex. So it can be different parts of the pelvic floor. So for example, it can be the superficial pelvic floor, which is like a calamari ring at the entrance, right? Or it can be a deep pelvic floor, which is normally, painful and deep thrust. So all of this can be because there is increased muscle tone, everything is a bit tighter, and people are experiencing that pain. Or sometimes in menopause, because things are more dried up and the tissue can be more frail and sensitive, as mentioned before, it can also have increase that sort of pain as well in touch. Yeah.
Yes. Okay. Yep. No, thanks for being so open about all of those things.
Yeah.
So what can we do about it? If we've got some of those things, how can someone like you help us?
Yeah. So I think early prevention is key. Yeah. So when you're pregnant, definitely go see a pelvic floor physio and get a check. That is a great education time to just understand the anatomy, and any sort of symptoms that you might have and start to address it really early. And most of the time during that period is really about prevention of like pelvic girdle pain or incontinence during pregnancy and to allow for a better rehab journey. Now, if you, let's say you missed that, then postpartum, it doesn't matter how late it is, it can be 6 weeks, it can be 6 years, right?
Mm.
Still go to see a pelvic floor physio to get it checked up. A lot of people do come just for a checkup. They might not have any symptoms to start with, but because they haven't checked it before, because the awareness wasn't there, they then come maybe around 40 or 45 and they get it checked at that time for prevention of symptoms in menopausal years. Yeah. And of course, if I think, you have any sort of symptoms during this time period, be it um, incontinence, any bladder or bowel issues, even constipation is something that we can address as well. Or if you have fecal incontinence, so either end of it, or lack of sensitivity in either pelvic floor or in the rectum, all of these things we can actually talk about. And of course, sense of heaviness, that's a very common symptom as well related to prolapse. All of these things, I think early prevention is key, and addressing that, at symptom onset is what we want to do. So, in terms of treatment, it really depends on the symptom. Yeah, so treatment pathway can be different for everybody. A lot of it is determined by what we find during the internal examination. Yeah, so we do an internal vaginal examination. That's a gold standard. And it's important to know that if, let's say, you don't want to do that, we have other ways of checking it too, like transperineal ultrasound or external observation. We can still get some information, even though not all information. But with that information, then we look at what we can do. A lot of the times, the basic would be pelvic floor muscle training. Yeah, so at least exercising the muscle layer to get some blood flow in, to increase awareness of how to contract, relax, train the endurance, train the agility. It's like training any other muscle in the body and start that journey of recovery.
Mm-hmm. Yeah. I mean, one thing that a lot of women ask me always is it too late? Have I left it too long? Like you would hear a lot too in postpartum, and they sort of think, oh, I didn't get in at the 6 weeks, so now it's too late. And I guess that would definitely be something that would be something that women would think of later in life too. Oh, this is just part of being a woman. This is another stage we've got to go through. We've just got to endure it. What would you say to that? Is it ever too late?
It's never too late. And I think with any symptom in the body, it's not healthy to look backwards.
Mm.
It's like people, there's no point in doing that. So whenever you feel like, whenever you get the awareness that you should go and get a checkup, or when symptoms do arise, as long as you're doing that straight away, I think that is the best that you can do.
Yeah,
Yeah.
yeah,
There's a lot of improvement in education and awareness these days for
definitely.
women, and that has changed a lot in the last 10 years.
Yes.
But I think if we keep focusing on, oh, it's too late, or I didn't do this, or I didn't do that, that might just make everything worse
Yeah.
because you're blaming yourself for it. So I think it's never too late. It's much better to do it now than never.
Yes.
Yeah.
Yeah. No, great insights. So, what about exercise when you're in your 40s and 50s? I know we do hear a bit of that now about how we need to change the type of exercise we're doing. What would be your suggestions around that?
Yeah, so exercise, I think when it comes to perimenopause and menopause, a lot of people talk about bone health. So
Mm.
increased risk of osteoporosis, which is what we see quite a lot from 45 years old onwards. And so the recommendation for prevention of bone loss is progressive exercise 2 to 3 times a week. And you want it to be weight bearing, so loading, yeah, vertically, which means you're upright, yeah. And it is quite a substantial weight. So you're not talking about like 10-kilo dumbbell. I'm talking about much more than that. And so, of course, you need to exercise in a safe and supervised manner. And so those are the guidelines as well. It needs to be supervised if you haven't been exercising for a while. You want to work on your balance as well, and you want to make it multi-joint. So not just single joint. I'm not just doing a bicep curl. I'm doing a whole, chain of movement, yeah, to make it functional. So that will be my exercise guideline for anyone sort of going 40 and above. And I
Mhm.
think what I find is postpartum women sometimes, because of motherhood task and change of lifestyle, change of identity, a lot of people might reduce their exercise around that time. And I
Yeah.
find what I say all the time to people around that age is try to keep it up as much as possible, even if it's just one day a week, right? It's much better than having nothing at all, because it's habit building. And I find the people that can stick to it around that time makes it much easier in the transition into perimenopausal age. Yeah, it's all to do with habits. Yeah, the moment you stop, it's really hard to pick it up. But if you can just keep it a little bit at a time, and be persistent about that and find the time to do it, even 15 minutes, and then go to 30 minutes. Those are really good things to really try to stick to.
Yeah, yeah, it definitely is about habit, isn't it? And the more
Yeah.
that you make it a practice, the more that it will just become part of your life.
Yeah, and it's lifting more than you think. Like some people also have the idea that, oh, when I get older, because my joints are a bit weaker, I'm going to lift less.
Yeah.
That's going to be completely the opposite. We want to think the opposite. Because you're a little bit weaker, we actually need to stimulate collagen, and we need loading. The bones and the joints will not have that stimulation of collagen unless you actually load it and use it. Yeah.
What if someone hasn't been used to doing weight training? Obviously, they would just start off quite light to begin with, is that? And then gradually build up.
Yeah,
Yeah.
yeah, definitely. So I highly recommend being supervised, yeah, by someone like a professional. And maybe the first thing is get a bone density test to start with. So if you're around 45, it's a really good age to start getting a bone density test, like a DEXA scan or anything. They're quite accessible in Sydney, at least where we live. And I think to start with that and understand, and then talk to a professional about having an exercise plan to start with. What we see all the time as musculoskeletal physios is that women around this age have a couple of things that are always happening. One is frozen shoulder, and second is glute tendinopathy and bursitis, so pain in the side hip. These are like two things, and the other one is like Achilles tendinopathy as well. And a lot of these can be aggravated by sudden loading, um, in in a manner that is, that exceeds what your tendons can tolerate.
Okay.
And so safe gradual return to exercise is really, really important.
Yeah. And are we talking about weight gain as being part of that loading that can cause some of these injuries?
Yeah, weight gain can be part of the loading. Normally, I think it's to do with that in clinic. I don't see weight gain as the cause of it. Normally, it is by a sudden change in load. So weight gain is normally quite gradual, but definitely weight management is one of the methods to manage, for example, Achilles tendinopathy.
Yeah, okay. Yeah.
Yeah. And any tendinopathy just means that the way that you load your tendon has exceeded the tendon loading capacity.
Yeah,
Yeah.
sure.
So instead of just removing the load, which is not really ideal in the long run, you can't always just keep doing less, right? We actually want to train the tendon to be able to load more. Yeah, in a gradual, progressive manner. I
Oh,
have
yeah.
to mention this as
Go.
well.
Yeah,
I've
go.
got one thing to mention when it comes to bone mass, is that women do lose up to like 5% of the bone mass through breastfeeding in the first 6 months of breastfeeding. So For a mum, if you think that, okay, nowadays mum go into motherhood a bit later, let's say mid-30s, so closer to the perimenopausal age, right? And then they also sometimes feed for 3 years, 4 years. Yeah, well, 2 to 3 years is what the average is. Sometimes I see in clinic. You can imagine the bone loss that is associated with that, right? At a later stage of life as well. And so definitely something that I think people are not aware of. And not to say that don't breastfeed, like you want to breastfeed, but you need to exercise so that you can counter that loss in the bone mass.
Yeah, yeah, so important. And it's just continuous reminders that we really need to understand how huge these things are, what kind of a toll they take on our bodies instead of, yeah, sure, they're passive, rites of passage, and we can move through these different stages that everybody, well, maybe I shouldn't say everybody, a lot of people want to have families.
Mm.
But also just kind of reminding ourselves what a toll that can take on our own bodies and that we do need to look after ourselves afterwards.
Yeah, definitely. And I think that people, like if you talk to my acupuncturists and traditional Chinese medicine practitioners, they always see it's like different gates of life. So if you can manage the postpartum journey really well, you are setting the foundation for your menopausal years.
Yes, yeah,
Yeah. And we can see that direct correlation as well as clinicians, and they're very important.
yeah, yeah, totally. Yeah. What about cardio? Because it kind of gets a bit of a bad rap as I think now, especially in this age group. Does cardio have a place?
Yeah, well, cardio is always, no matter what life stage, there is always a cardio recommendation when it comes to exercise guideline. Um, I would say between cardio and strength training, if I have to prioritize one, I will go strength training. Yeah, and cardio is also to do with capacity, right?
Hmm.
So if let's say you do have a dodgy knee, yeah, you have arthritis and stuff like that, and some of those is not that you for it's not like bone health where you force it and it will get better. So I think you do have to understand the limitations of the body when it comes to cardio and choose the cardio activities that suit you. And there's so many. You can have land-based, like actually running, or playing a team sport, but you can also go swimming or cycling, and those have like better implications for your joints. So if between both you have time to do both, I think definitely incorporate both into your exercise routine. But in the life stage where you're really busy and you can only dedicate maybe 2 times a week for training, I will focus on strength training.
Yeah, okay.
Yeah.
It's just really a mindset shift as well, isn't it? And not seeing like if you've been a person that's, really hardcore with their exercise, I think it can feel like a bit of a fail if you suddenly have to pivot and do something different than what you've been accustomed to doing. But it's not. It's just really recognizing the different stages of life and what's most appropriate at different times.
Yeah.
Yeah.
And I think if you think about an athlete or even a dancer, right? The cardio is really good. They have been doing cardio for ages. And as they get into that midlife, I do recommend them to start lifting if they haven't been lifting.
Mm-hmm.
That is a complementary thing. You need to start lifting because your body's changing.
Yeah.
Yeah. And so there are different emphasis in terms of building your bones and joints and health.
Yeah.
And it's that transition that we need to honor.
Yeah, that's so right. I think we're hopefully, as you said, we've come a long way with our awareness too of postpartum. So I hope that more and more that we start to get a lot more information about honouring this next phase of life. Yeah.
Yeah.
So tell us about some of the holistic plans that you also offer in your clinic space and why you also believe that, it isn't a one size fits all, that it really is a tailored plan and that's multifaceted in its approach.
Oh yeah, it's definitely holistic and multifaceted. So my background is pelvic floor physio, right? And Papaya Clinic is holistic, multidisciplinary, where we have naturopath and acupuncturists and psychologists as well as physios. And the reason for that is because I find when women's health, especially when it comes to the menopausal age, symptoms vary. Yeah. And yes, it is all caused by a dip in your hormonal levels, but your symptoms really vary and for everyone is very different. So you cannot have like a one treatment plan for everybody. It just cannot be the case. And because your symptoms can cross over your pelvic health, your cardiovascular and musculoskeletal health, bone and joints, and also your emotional side of things, some people can get affected like really, really a lot. Gut, nutrition, weight gain. A lot of people talk about metabolic health and weight gain and not being able to, lose weight as easily as before. Like all of those different symptoms need a different professional to help you with it. There is no one specialist that knows all of it.
No.
Yeah. So it is about, again, acknowledging the different domains of, or the different pillars of health, and making sure that you have a team that talks to each other and that can look at you as a whole person, do the testing that is required to figure out what is the bit that we can achieve the quickest change, and then plan with you and have a tailored plan. So in Papaya, like we have two things. One is a programmed approach. People come in and we run a menopause program, and that's 4 months. You include all the testing, so functional testing like gut test, and a range of different tests across different disciplines as well. And when people come back with the assessment results and the testing and pathology, we look at it as a team and figure out who is the best person to manage this patient. Yeah. And do they need more pelvic health support, or do they need more nutritional support? And then we make a plan that way. Exercise is a must, so we include them into our exercise classes weekly. But the journey outside of that can vary a lot. So that's a programmed approach. And if you do come to see us as individual practitioners, we will all be talking internally to see, okay, it depends on the questions that we ask, but the more that we understand about something, the more that we can encourage internal referrals to say that, okay, maybe for these symptoms, you should see the acupuncturist for it, whereas I manage these other symptoms. So yeah, so that is an integrative approach to health.
I love that so much. Yeah. It's so true. Like it's so multidisciplinary, and just, I think it would be quite arrogant actually just to think that one practitioner can help a woman through her very complex cycles of life. And I love
Yeah.
that you've included a psychologist too, because so many women are talking about depression that they've never felt before, sadness, crying, and just not really understanding or being able to process all these feelings. So that's amazing, not just addressing the physical symptoms, but also the emotional and mental toll that it takes. Are you finding that there's a lot of GPs now that are working well with you, and that's a nice relationship that you can have with them as well in also making that part of the team?
I think more and more GPs are aware of it. And so, for example, this year there is, I think, Dr. Kerry from North Sydney. She was holding So Hot Right Now, which is like a big conference at Sydney Opera House.
Yes.
That got a lot of traction. And then there's also the medical conference after for the GPs and other medicals as well. And that gives me a first glimpse of, which I didn't know before, but menopause is not like it's not a big training part in the sort of doctor's degree. And again, like we don't know if we're not in that health profession. They wouldn't know what we know and we wouldn't know what they know. We assumed that it is part of the training, but it's not. So yeah, so I think all the different professions, and it's really good that GP is also leading the way as well, but all the different professions, we are all upskilling in menopause care.
Mm.
And when this happens more and more, so in the next 2 or 3 years, I can really see a lot more collaboration that will happen. At the moment, if you ask me for recommendations for good GPs in Sydney, there are probably less than 10. So, so yeah, but that will change as the scene starts to change and people's, advocacy work starts to be heard. Like that will change. So I'm looking forward to that.
Absolutely. Yeah. I mean,
Yeah.
I'm seeing a really good one. I think a
Mm.
lot of people know Dr. Eliza, who
Yeah.
focuses on, families. But yeah, she also is taking a special interest in this because she also, recognizes that this is a very important stage too. And often they're connecting, like postpartum and perimenopause are coming very closely together. So I think more and more GPs, with the training and with the education, is giving them confidence to treat people in a much more holistic manner. Then,
Mm.
yeah, like everything, the more we know, the more we feel confident in talking about it. So I feel grateful that I'm coming into that stage of life at a time when there is a lot more consciousness of this stage. And, a lot of women in the past just had to put up with so much in silence, really. And of course, HRT had such a bad rap many years ago, so that was like a no-go zone. But there's a lot more information, which is great.
Yeah, I'm glad that it took a turn. And I think also with health professionals, if you look at the people leading the way, they're all going into that menopausal age as well, like perimenopausal age. And so I think it's something that's very close to heart. And as more pelvic health physios get a bit older as well, I think that is what you're going to see coming out a lot, because all the education was like pre and postnatal for the last 10 years, 8 to 10 years,
That's
right?
right.
And that will change as the generation gets older as well.
Yes, yeah, it's
Yeah.
always usually born out of our own experiences, isn't it? That we become
Yeah.
very interested in, okay, I understand this now, and I'd love to be able to support other women through this.
Yeah, definitely.
Yeah. So, how can our listeners find you? And your packages are wonderful. So, how can they learn more about those?
Yeah, so you can visit our website, which is papayaclinic.com.au. We have a lot of blog articles on menopause and the holistic integrative approach to menopause. And also we have some downloadable materials and resources for patients. When it comes to, understanding SUI, so stress incontinence, understanding prolapse, or any sort of pelvic floor related things, there is a lot on the website. Yeah, we also have papaya community nights, which we call papaya conversations, and they're run once a month this year, and most likely we'll be running once per 2 months next year.
Yep.
And we have different topics. So one of the topics will definitely be menopause, but also we run other ones, which is just women's health nights. So you can come in and ask any questions that you want. And we always have a health panel, which is really helpful to have different perspective to treat the same thing. And also our menopause mastery program is on the website as well. So it's a 4 months program, and you can find all the inclusions on the website.
Wonderful. Okay. Thank you so much for your time again, and for being our Postpartum is Forever resident physiotherapist.
Thanks so much,
For
Katura.
more conversations.
Yes, thank you so much.
Thank you. I trust that you enjoyed this episode. Postpartum is Forever is a podcast that is focused on honouring the mother. My wish for you is that you feel more aware, less alone, more empowered, and a whole lot kinder to yourself in your mothering. Your support means the world to me, and so I would be grateful if you could follow me on my Instagram page, Postpartum is Forever Podcast, and share this podcast on your socials. Rate and review this podcast on whatever platform you're listening from, and subscribe so that you never miss an episode. Big love.